We talk regularly, premiers across the country. There's a First Minister's call later this afternoon I'll be participating in with the Prime Minister and his team. And we're sharing best practices at all times. And we have, from the beginning, you'll know that it was January when public health officials and the Ministry of Health and Minister Dix started talking about COVID-19 as a problem that may well make its way to British Columbia. So we've been doing work for some months now to prepare. I think Minister Dix talked today about the capacity within the acute care system that exists today. It's extraordinary what we've been able to accomplish in a short period of time, anticipating increased numbers of cases that will require acute care. But that modeling is being done, and there'll be more to say about that later in the week. But when it comes to a lockdown or a shutdown, unprecedented in my experience that our borders are closed to anyone but essential personnel or essential individuals. Our economy is grinding to a slowdown at the direction of our health officials, but also from workers who are saying, I better heed this advice and self-isolate. I better do what I'm being asked to do to contribute to us getting through this and flattening the curve. So saying lockdown, saying shutdown is really easy to do, but it's difficult in reality. And the list of exemptions in California, for example, is not unlike the list of exemptions that we have in place here today. So I would rather than get caught up on how we're going to say to business, how we're going to say to workers, how we're going to say to the broader economy, this is how we're going forward, and we use terms like lockdown and shutdown that, in my opinion, will create more confusion rather than less. We're working sector by sector, making sure that those individuals critically important to the delivery of health services to people that are vulnerable, which is our highest priority right now. We need to make sure that there's a clear understanding. We do need childcare workers to be in place, and we're grateful that they're stepping up. We do need people working in our retail sector to make sure we're getting goods and services to people that desperately need them, particularly those healthcare workers that are on the front lines, putting themselves at risk. All of that requires a methodical, thoughtful, science-based approach, and it may well be satisfying to say we're going to shut something down, but we need to make sure we're doing it in a way that makes sense. One thing we've already been working on is WorkSafe BC is working with the healthcare professionals across the province to make sure that work sites are safe. How can we make them safer? Those types of initiatives are all useful and will be able to inform us in the months ahead. But I don't want to rule out anything less, having given you that long-winded answer. But we need to be thoughtful about this, and we need to be driven by the science and the direction we get from public health officials, and also the willingness of the private sector to be able to comply with the delivery of these very critical services that we're going to need in the days and weeks ahead.